Hello and welcome to this special speaker story bank conversation about women's health, especially our pelvic floor health. Dr. Nicole Fleischmann, who is joining me tonight, is a distinguished surgeon, a board-certified urologist and urogynecologist, and she's on a mission to wake women up to a long-ignored truth. Our pelvic health is in crisis. And, the way we've been taught to care for it is deeply flawed. And quite frankly, I don't know that we've ever really been taught to care for it. And that's one of the bigger conversations that I've had with Dr. Fleischmann. She's been a dear friend of mine for over 25 years. And as I've joked over the years of knowing her as a urologist, I've always said, I'm like, Nicole, I will call you when I'm 80, when I need you. And the problem is that we need her now more than ever, because there are more women facing issues with their pelvic floor than ever before. And many of them are very young too. There are more women coming in their 20s with UTIs. There are athletes, young athletes who have stress incontinence. There are just women in corporate America who are experiencing the same. And the list goes on and on. And this is just one of the many conversations that we're going to have tonight. And I'm so grateful to be joined tonight by you, Dr. Nicole Fleischmann. Welcome.
Thanks, Marjana, for having me. It's very
Uh,
exciting to be here.
Yeah, listen, you and I have been having conversations every Sunday about this because, you are on a mission. And part of what I want to do is just to help get your voice out. And as you know, part of the goal that I have with Speaker Story Bank, yes, I work in the speaking industry, bring lots of different speakers to different stages, but I also really care deeply about the thought leaders who are doing the work out there, who are making an impact and a difference, who are helping people think differently, but more importantly, do differently. And that is exactly what you're doing. So I'm just so grateful to be able to have this platform with you and really start to have the conversation with many more women. And just like, when you talk about these kinds of things with your patients, the big thing, they kind of look at you dumbfounded at first, right? I think this has kind of been your experience from the start.
Yes, it is. Trying to get people to understand how their bodies work is it's a very overwhelming experience, both for the patient and the doctor.
Yeah.
Um, so yes, but I'm seeing great success with helping people make some really important mind-body connections. That's really what we're talking about here. We're talking about how to be able to learn to control the body a little bit differently by listening to it and understanding its cues, understanding its language, and responding appropriately. And
Mm.
these are skills that need to be taught to us. We don't really develop them naturally on our own, and because of that, pelvic floor control or pelvic floor awareness. There's a lot of different ways we can call it. It's missing in many women's lives, and it's actually quite easy to gain if somebody just guides you through it. So my mission is really to be a guide, to translate some of this information so that, like you said, people can really apply it in their lives.
Yeah.
It's one thing to understand, and it's one thing to actually be able to apply.
Mm. So I'd love to start with sort of the challenge, the data. I mean, you're seeing a lot of changes, over the course of the years that you've been in practice doing this and seeing women for many different ailments around pelvic health. But now you're seeing a lot of younger women too. Can you just share some data with us about why this is becoming more, as we say, like it's a silent epidemic, it's a crisis, and something that's really important for you to explore?
So women of all ages experience pelvic health problems, we should say. It's really a body disconnection that starts very early in childhood, which is why we see people of all ages having struggles. It's also very much related to anxiety and stress. So when we don't have a appropriate mind-body connection, when we go through stressful times, our bodies suffer without a really strong foundational connection to our pelvic floor. That's really what this is about. So you can experience problems like incontinence, urinary tract infections, pelvic pain, at any age. If you haven't built that connection, you're susceptible.
Mm. And I mean, Let me see. Oh, okay. I want to make sure I was going. I went on mute there for a minute. Um, so, I mean, here's the thing though, what you're discovering also, again, the data for you is real practical data. You're getting this from your patients. And as you shared with me, and this is kind of what piqued my interest too. You were saying that after years of, even when you had to perform surgeries on some patients and having performed perfect surgeries, and then still problems start to happen, you started to get more curious about, why is this happening? What are other solutions? And that's the part that I love, right? Because we always have to continue to be learning and changing, and there's always something. So I love that you got deeply curious in your field. But as you did that, what were some of the discoveries that you were making?
So I think the main discovery is that you can understand intellectually how things work. And I spent many years studying structural problems in women. And when I say structural problems, I mean problems related to, a dropping bladder. That's a structural problem. So if your bladder is low after childbirth, it could be lifted, and that would change the structure and put it back to where it belongs. But it turns out that when we do that, we don't always get the perfect results that we are looking for, even if we do a perfect surgery. And that's because the reason why the bladder has fallen to begin with is not being addressed. And that took me a very long time to understand. See, I thought that these problems just happen to women. That's what I learned in medical school. This is something that just happens to us. If you have children and you're likely to have a falling bladder or a leaky bladder. That's just what happens to women. And what I didn't realize is that it's not supposed to happen to us. If we can understand how to move our bodies appropriately at the times when we need to move them appropriately, we can avoid pelvic floor damage so that we don't have a structural problem. And that took me a long time to understand. But when I did understand it, I could walk my patients through what making that connection actually meant. And when we learned that, they got better sometimes without even having to get to the operating room. So that was a huge aha moment for me to say, wait a second, we don't have to operate on all these structural problems. We can fix the
Mm.
functional problems first and see if we then need to go and fix the structural problem. That it's just a different way to look at our field, I think.
Yeah.
And it's more conservative, it's more holistic.
So when you have a woman that potentially you're considering surgery, or you're thinking this might happen a few months from now if we don't fix it, what is the conversation that you're having with someone who might need that?
I think when we're talking in these broad terms, it's always best to give like a more concrete example. So let's talk about urine leakage. Let's talk about something
Mm.
like stress incontinence, which is one of my favorite topics because I've always been very interested in leaky bladders. Um,
Mm.
so stress incontinence is really damage to the sphincter muscle of the opening of the bladder. And the sphincter is it's a little closure seal that tightens so that urine doesn't come out. The thing about the sphincter is that it needs to be protected throughout our lives. And when I say protected, we can't put unnecessary pressure on it.
Mm.
So what I understand now, which maybe I didn't understand when I was first in training, is that we are always putting pressure on that sphincter muscle without noticing it. And that's an unconscious behavior that many women have from early childhood. It's called voiding dysfunctional, dysfunctional voiding. And what it basically means is that we are pushing to start our streams. Pushing out the urine is something that all little girls do very naturally because at that point in their lives, that's where their cognitive development, that's what their cognitive development supports. Um, and so it's totally appropriate for a 3-year-old who's learning how to get out of diapers and trying to figure out how to release urine from her body to start with a push. The thing about pushing is that we don't even know what that means. So if I ask many women whether they push out their pee, not everybody will admit to it. Some people
Mm.
just say, no, I relax and it comes out without understanding that relaxing is actually pushing.
Mm. Or that holding your breath, right? You don't even know it, but you're
Yeah,
kind of like holding.
relaxing anytime you kind of bear down or
Um,
just shift your posture or whatever it is that you do to start your urine stream, it tends to be dysfunctional. without the guidance to know what functional urination actually is, you will continue to do postural behaviors, breath holding behaviors, or outright pushing behaviors on the toilet throughout your whole life until your sphincter muscle starts to fail.
Mm,
And this is how we can avoid problems. When we learn what functional urination actually means in our body, not just what we can read in a textbook, when we actually know what that means for us to do it, we can fix it. We can
yeah.
turn it around. It's not
Uh,
that hard.
and how is it that this is not part of what you studied or what urologists study, when they study this? Like, how is it that this is now coming out as sort of a newer thinking around this?
It's not a newer thinking. It's quite
Mm,
an old thinking. We're talking about paying attention to our inner body sensations and responding to them appropriately. And it's very hard in the medical field to test this kind of knowledge.
mm,
This is not something that we can do a randomized controlled study on, or that it's just a different type of understanding. So for instance, I can tell you that there are many textbook articles that say that diaphragmatic engagement is necessary for functional urination. What does that mean to you, Marjana?
mm.
If I say to
Uh,
you diaphragmatic engagement is necessary for functional urination, does that teach you how to pee? Do you understand
no,
what that
no.
means?
Right.
Right.
I mean, I understand it better now from talking to you, but
Okay, but
yeah,
that's because you spent, the
yeah.
last year hearing me rant and rave about it. But for you as a person to understand what that actually means, you have to know some techniques. You have to understand some skills in your body, how to engage your diaphragm, how to
Mm,
pay attention to the other side of your body when you're releasing urine. And
mm,
this is something that we're not taught to do. We just let things happen automatically, like we did when we were 3 years old, not
yeah.
understanding that there's another way to do things that's better for us.
Mm. So, I mean, when you looked at stress incontinence in this way and started thinking about it differently, when did you start realizing that there was a different kind of breath technique that would help?
Well, actually, I mean, this for me, this is I'm a scientist at heart. Remember, so this is I've gone through many years of medical school training and surgical
Mhm.
training and teaching. So I like to test things out. But I was paying attention to something that was happening in my practice. I was doing injections to treat people's leakage, urine leakage, and I was noticing that women were pushing out the product that I was injecting. They were
Mm,
pushing it out. So in other words, it's like I take you to a nice restaurant, right? I feed you an expensive meal and then you go up in the bathroom and you throw it up. And I'll say that's a waste. I spent all this money taking you out to dinner. Why did you throw up the meal?
but they didn't
This
know
is
they
what
were
wa-
pushing it
this
out.
is what was happening. They were literally pushing out the injection. And I
Mm,
said to myself, why are all these women pushing? And
mm,
it didn't even to me, I was like, is this something that we're supposed to be doing? Is this how we're supposed to start our streams? No, that's not true. I started to make the connection that pushing to pee and stress incontinence were actually the same. That
mm,
people who pushed were more likely to develop leakage problems. And then when I was trying to correct the problem, because I hadn't told them not to push or taught them another way to release urine from their bodies, they continued to do it and to struggle. They just
mm,
required a little bit more guidance. And
right.
that's not really necessarily in the medical school books. That's not nobody said to us when I was in medical school, by the way, people don't actually know how to pee, you have to teach them. Or people don't actually know how to breathe. You have to teach them.
Hmm. Yeah. So then how did you come around to discovering the right breathing technique for this?
So this is actually what my book, The Second Mouth, is about. Because the whole book is the discovery of the understanding, which took me many years really to understand. I'm almost embarrassed about how long it took me now, but I take solace in the fact that nobody else really knows it either. So I
Mm,
didn't feel so bad when I thought about
yeah.
it that
Yeah.
way.
And tell us before you get into the book. Yeah, exactly. Such a provocative title, The Second Mouth. Makes sense. But what got you thinking about it that way?
I think I started to understand it in my own body. Anybody who gets interested in a subject, remember, they're interested in this subject because they're trying to figure out something in themselves too. And I personally suffered from years of pelvic floor dysfunction. My whole childhood and well into my adulthood. I had 3 kids. I'm a mom. I pushed out a baby. Um, I suffered the damage of that. And so I was just as disconnected as all of my patients. And just to heal my own body, I I learned I look at it as like a group healing process that I could heal my own body and also teach my patients how to heal. And what I began to understand was that I didn't understand my own functional anatomy. I didn't
Mm,
understand that I had a mechanism on the other side of my body to open as if it was a mouth, just like the mouth at the top of our body. We have a mechanism on the other side of our body to open to release urine and stool. And this opening process is not something that is easy to understand. That's why children don't necessarily naturally develop it. It's something that has to be taught. And it's taught by learning how to coordinate your breath with your pelvic floor when you evacuate.
mm. So do you want to, right? And you call this the sniff. This is different from
Ah, the snip. Okay.
a
So
slow
this
breathing. Yeah.
All right, so there's many layers to this. I wish it was simple and I could just explain this away with words. It's not. So that's why sometimes the best way to talk about it is just to show it. It's just to say, this is what we're talking about. Because I could
Mhm,
talk about this all evening and you might not get it until I just tell you to sniff.
mhm,
Okay. Now, a sniff is not something that everybody knows how to do either. That's another thing that I had to come to terms with, that a lot of people don't know what a sniff means. So, a
mhm,
sniff is just a facial gesture where you bring air quickly through your nose, but you only use your nose. You don't use
mhm,
any other part of your body, not your chest, not your neck. You don't crinkle up your face like this when you sniff. You relax everything. You relax your abdomen. You relax the area that you're sitting on, and you just take a quick sniff. And if
mhm,
you are paying attention, as I hope you will, you'll feel emotion on the other side of your body, in your muscles, the muscles that you sit on. And it
mhm,
feels like an opening. It's a quick sniff. And what that sniff is doing is it's quickly engaging your diaphragm. That's what the sniff does. It stimulates your phrenic nerve. And we know that from animal research. All this is in the books. I'm not creating science here. Science was created many times over. So the sniff naturally engages the diaphragm. It also naturally engages your pelvic floor if you allow it.
mm.
Now,
Yeah.
you don't have to allow it. You can start in a clamped and guarded position and you won't feel a thing. So you have to relax first to feel the sniff hit your bottom. When you do, that's when you've made that cognitive mind body connection to understand that that's the motion for urination and defecation. It
Mm,
starts with a sniff.
yeah. So when you first share that with some of your patients, how do they respond to that? Do they immediately feel it, get it, or do you feel, again, you've talked about embodiment, the mind body connection. There's some of your patients that can feel it faster, easier. How are you seeing that play out with your patients?
Right. So pelvic floor dysfunction basically is a mind body disconnection in my book. That's how I define it. I don't think you're going to hear that from every urogynecologist or physical therapist, but that's really how I see it. And what I'm basically saying is that you haven't learned to connect your breath with the other side of your body. You haven't learned to move your body properly in order to just breathe. So if you're sucking in your stomach and you're sucking in your diaphragm, which is probably the way you've been told to stand your whole life, this is a conditioned behavior where you've been conditioned away from using your diaphragm the way it was meant to be used. All right. And as soon as we do that, we debilitate our own body's ability to breathe, urinate, and defecate properly. And
Mm,
that's really a disconnection. So some people, just by telling them about this, they can take it down and understand. Others, not so easy. They don't know they're clamping. They don't know they're guarding. They don't know how tight they are. They don't know they're clenching. They have no idea that they're even doing it. So you have to bring that to their awareness and explain this to them so they can learn to just take down the guarding reflex on the other side of their body so they can urinate properly.
Yeah. So it's, I mean, just the simple awareness, the fact that you're starting to even have these conversations, and you might have to have multiple conversations, but creating an awareness around this, which really is even what you're trying to do just with the book and even these wider conversations that you're having over podcasts, right?
I'm trying to create embodied awareness, which is not something that you can read about in a book. It's something
Mm,
that you have to feel within your body. It can also be modeled from person to person. So when I make certain facial maneuvers, you can copy them. If I say this is a sniff, you can look at my face and try to copy that. You can try to copy the sound of my sniff to know that that is what's necessary to release urine from your body. It's not something you can read in a book. And that's, I think, why we've gotten so far off track with so many of these body processes, because we're trying
mm,
to read about something that we actually just have to experience.
yeah. How are your peers responding to this, this work that you're doing, these conversations about this?
Ah, I would say that there's a lot of interest. I think we're all suffering as physicians. First of all, this field of women's health is a field that's been really put aside for many, many years. And the kind people that go into it are overwhelmed. They're just overwhelmed
Mm,
with patients and people who have problems. And they are looking for solutions too. Um, Most of the solutions that we've been taught are about medications and surgery. And the bottom line is none of those things actually work long term. They're quick fixes. They're not actually mind body connections. They're not learning what you're supposed to learn. Which is why when you go down that road, even though you might develop some relief, say from like a sling procedure, you might stop leaking urine, but rest assured, down the road, something else is going to pop up. Recurrent urinary
mm,
tract infections, or you're going to drop your bladder out because you never learn to stop pushing out your pee. And so those that's to me that's not the fix. I mean, it's not that you can't do those things. They do work, but they don't really get to the heart of the whole problem. And I really want people to be able to have this information so that they can then decide whether they want to go down that road of surgery or medicine, or whether they just want to try to feel this stuff in their own bodies first and see if
yeah.
it just makes them feel better. Because a lot of my patients don't end up in surgery after they teach them how to coordinate their breath with their bowels, their breath with their urine flow. When I teach them how to breathe, when I teach them how to bring
Mm,
blood flow to the other side of the body, become aware of the other side of your body, know how to push your belly out when you breathe in instead of sucking in, which is
yeah.
dysfunctional. These are just habits that we have to learn to break so that we can break these cycles of pelvic floor dysfunction.
Mm. I think I know one of the conversations we had, it was kind of that awakening where you're like, people are walking around crushing their organs by just, again,
Yes.
sucking everything in. And it just, you, I
Yes,
guess
we are the
we
only
don't think about it.
animals on the planet that suck in our guts. I just want
Mm,
people to be aware of that. There is no other animal on the planet that sucks their stomachs in. And
hmm,
and yet we teach this to each other as if it's God's truth. It's not.
right.
It's absolutely dysfunctional. When you think about the point of view of your organs, and I always tell my patients, take the point of view of your organs, take the point of view of your bladder, pretend you're living inside your body. Would you want space in there to do your job, or would you want the walls caving in on you? I
Mm,
can tell you, I'll speak for your organs. They don't want the walls caving in on them. They want room to move, they want blood flow, and they want oxygen. And as
yeah.
long as you're sucking in your stomach, not moving your diaphragm to breathe, upper half breathing, chest breathing, and mouth breathing, and this is the basic stuff that all of us are doing, whether we're aware of it or not, we are literally cutting off the blood supply to the other side of our bodies. And
Mm,
we're wondering why it hurts. So I just have to say, listen, just do it differently. Just learn to sniff when you breathe, because that's the
mm,
start of a functional breath. When you
yeah.
do that, you're bringing air and blood flow to the inside of your body, and you're developing a conscious awareness of the other side of your body. I mean, core awareness. I'd like to speak in terms that people maybe know. Core awareness means you're aware that your core can expand with airflow. That's what you're trying to learn. That you shouldn't leave your core sucked in when you breathe, or you're going to create serious problems in your body.
Mm. You know, you said something really provocative. I don't know if you want to say it again, but I'll say it for you, and you could correct me if I'm wrong. But I asked you, I said, what do you think would change if everybody knew how to breathe and take the sniff and really bring the airflow to their bodies? And in that conversation, you were just like, what would change? We would have more time to do all sorts of things because we'd be healthier, just all around overall health.
Our brains could stop focusing on what's wrong with me and
Mm,
start focusing a little bit more on more important things. See, from
mm,
this kind of framework, which is a much more holistic framework, and functional medicine tends to be more holistic, we look at root causes of what's going on, and that symptoms are just a manifestation of a root cause, right? So people come to me and they want to tell me all of their symptoms, and they want to tell me that they're leaking urine. They want to tell me that they're burning when they urinate. They want to tell me they're constantly getting urinary tract infections. And I say, look, all of that is important. What you feel is important because that's what you feel. But it doesn't mean that those things are your actual problem. Your actual problem is a mind body disconnection. And this is how your body is telling you about it. So when you look at it from that perspective, you stop thinking there's something wrong with me and you just realize that you're not doing something right.
mm.
You're not driving your car properly. You're putting your brake and your gas on at the same time. Your car's not going to run like that. And
Yeah.
that's just it's just like when you start to understand those principles, um, you can just figure it out. You can get better.
Mm. Let's talk about the young women who are, you told me about young athletes who have sort of, I guess it's a form of stress incontinence with young athletes, but just the younger women who are facing lots more UTIs. Where do we start to help them then?
Marjana, there are so many problems that I don't even know where to start. I think starting is just with education, obviously, and getting some
Mm,
understanding out that's a little bit different than maybe what we've heard. But really, we have to stop just glorifying a sucked in stomach to young women. This
mm,
is going to be so this idea that the stomach is flat and with women athletes, they're doing a lot of core tightening type of work. Runners, I can't tell you, ballet dancers,
yeah.
horseback riders. These women are so tight in their bodies. They are literally putting so much pressure on the openings of their body, their lower openings of their body, that they can't get urine and stool out effectively. That's that's scary. They have to push really hard, or it's just leaking out without their
Mm,
awareness. That's a dysfunctional pelvic floor. All they have to do is learn to release these muscles properly. And the only way to release them is with their breath. But they have to learn how to breathe. They can't breathe with their chests, which is what a lot of people are doing, just without even knowing it. That's what they're doing.
mm. But there is a way to sort of walk and be where, okay, you're not sucking everything in, but with a certain posture, I mean, you could still be a little flatter if you're in shape, right? I mean, let's face it, like you're not going to have a
So,
flat stomach if you're
so
not in shape.
sucking in your core, just so you know, does not strengthen your abdominal wall. That's a huge misconception. If anything, it
Mm,
weakens it. You just have to understand that when you suck in your core, you are weakening it.
mm,
And that's a great truth of life. So if you want to strengthen your abdominal wall, you have to let it move. It needs to be
mm,
mobile, in motion. Okay? Because the diaphragm pushes the abdominal wall out when we breathe. So if you want to breathe when you're walking around, you can't be sucking in your abdomen at all. But you can have a straight spine. So this is where posture comes in. We can stand with a very straight spine, but not sucking in our abdomen. In
mm.
fact, there's lots of exercises you can do to realize that if you are sucking in your core, you won't have a straight spine. Your
Yeah.
spine can only be straight when your abdominal wall is released. And I teach a lot of my patients how to lie on their backs to feel their spine straight on the floor. And they
Mhm,
notice that as long as they're sucking in their stomachs, they can't get their spine on the floor. It's not until
mm,
they release their abdominal wall and let their diaphragms go that they can
right.
develop a straight spine. And your body needs a straight spine so that it doesn't
Or
develop
when you're
back
laying down,
problems.
your lower back even is down instead of in that
The
arched
saddling
position.
of the back or the
Mhm,
swaying of the lower back is a dysfunction. It's a disconnection. You don't have to have a sway back. None of this, oh, my back is just swayed. No, you are allowing your back to sway by not pulling your lower back inward so that your
Mm,
hips are aligned. And that's just a disconnection. So as we make these body connections, this is part of child development. We can walk a child through this so that by the
mm,
time they're 16, they can still run track and not pee all over the track.
yeah. So, okay, for any parent that's watching this that has a daughter, who's an athlete who might be experiencing this, I know you did this really great TikTok, and I'll have to put it in comments later, but you did a great sort of TikTok. It was almost miming what they have to do, right? But is there anything you could share here or in conversation or just show us that
So
anybody can, share with their
yeah,
daughters?
I'll show you what I show my patients, and these are like
Mm,
little techniques that you can teach. I say, before you start telling her to push her stomach out when she's walking around, because she's not going to do that. And the children, the young women, they are very conditioned to want to have that really, flat stomach. But you can start with what's going on the toilet, because that's really where they're going to get the biggest uh, um, advantage and relief from their problems.
mm,
I teach them how to posture themselves with a straight back and leaning forward so that their elbows are on their knees. This is toilet posture. This is for the bowels and the bladder. No sitting up straight, just leaning
mhm,
forward. Okay. And I tell them to put their finger under their nose like a mustache and to
mhm,
smell their finger. And when they
mm,
do that maneuver, they can feel the second mouth maneuver. What that means is that as you smell your finger, you literally feel your belly going out and your tailbone moving backward. And that's the lower jaw of the second mouth that's opening and releasing pressure off of your bladder and your
mm.
bowels so that everything evacuates without you doing the work. Your organs do the work. That's
Yeah.
what we're trying to get kids to understand. They shouldn't be doing the work to release things from their organs. Their organs will do it for them. All they need to do is open their bottoms.
Yeah. Yeah. And, I mean, my own daughter, she's 11, and we've been talking about this, and she heard you and I
I love
talking
that.
about this. And I mean, she's been practicing it and she feels different. And let's face it, a lot of our young girls and boys, they have issues with constipation. There's a lot of anxiety that kids are facing. So I want anyone watching this to just understand this is happening to our children. And we have, and Dr. Fleischmann has a solution, and it is working. I mean, it's just about the
It
awareness,
totally works.
right?
That's the thing. It works for everybody, but they have to get
Mm,
it. So I really think we can turn around a lot of childhood bladder and bowel dysfunction just by teaching people to release urine and stool by coordinating it with their breath. But it's not any
yeah.
breath. It's a sniff enhanced breath. It's a breath that starts with a sniff.
Mm,
And the reason it has to start with the sniff is because the sniff is the nerve signal that opens the sphincter muscles on the other side of the body. And you
yeah.
can feel it. When you take a quick sniff, you can feel that opening. And
Mhm.
all you need to do is go with it. Just make it bigger, make it
Yeah.
wider.
Yeah.
Yeah.
And you're right. It's different. Like it's a quick sniff, not a long inhale. You know what I mean? And there's a difference to that.
The quick sniff is the nerve signal. That's when you make a
Mhm.
brain bottom connection. When you take a sniff and you feel your bottom kind of contract open, that's a brain bottom connection. So that's the pathway for urination, defecation, and breathing. We're supposed to breathe. When you breathe, you're supposed to feel it on the other side of your body. That's why lower half breathing is the way human beings are supposed to breathe. And all the animals in the animal kingdom breathe that way too. And
Mhm.
infants breathe that way. If you ever watch a newborn, that little child is breathing with her diaphragm. She
Mm.
knows what to do. We
Breathing
are
smarter than we
conditioning
are.
out.
Right.
We are reverse conditioning all of the natural behaviors out of our children by
Mm.
teaching them to suck in their stomachs and push out their pee. And we're teaching them because we're doing it and they are modeling us.
Wow.
That's what
Yeah.
this is about.
Well, speaking of being taught one way that might not be helping us, one of the other conversations that a lot of friends, as I'm sharing this with them, continue to ask about is the Kegels exercises, right? I mean, we're taught to do
Yeah.
Kegels for a variety of reasons over our lifetime. Can you just, yeah, share sort of your whole theory, understanding, and what you believe about this today?
See, once you understand the model of the second mouth, you can understand why Kegels are not the right thing to do. So
Mm.
if you think of your bottom as a mouth, right? And everything, you're born with it closed. And neurologically, the milestone is learning to open it up. Okay? If you have not learned to open your mouth, it makes no sense to go tighter, especially when tightness is your problem. Tightness is your problem. So Kegels exercises are the absolute wrong direction. And
Mm.
they don't help strengthen the area that you're trying to strengthen, which is your sphincter muscle. The Kegels don't strengthen the sphincter. If anything, they just compress it further and deoxygenate it further
Mm. Yeah.
and devascularize it further. Your pelvic floor muscles are not there to hold your pee in. That's what children think, but adults understand that we don't need to do anything to hold our pee in. Our bladder does it for us. We just have to stop clamping around it. Because at
Mm.
some point, and this is where age and menopause starts to play a role. If you haven't figured this out by the time you hit menopause, and you have a deoxygenated state on the other side of your body because you've lost estrogen, clamping behaviors are going to make this so much worse. We have
Mm.
to stop walking around clamping. We have to just learn to breathe.
Mm.
All your bladder wants is air. It doesn't want your help holding pee.
Yeah.
And I have to just reverse that understanding in my patients' brains so they can stop trying to suppress their bladders all day long like they did when they were children. You can
Mm.
tolerate that as a child, not as an adult.
Yeah. So you mean so women who are going through menopause as well and who talk about vaginal dryness and those kinds of things that you're saying again, just by the breath and blood flow back into the area, that's all it
It
takes.
don't hurt, girl. See, that's the thing. None of this hurts your body. If you are going to enhance bringing blood flow and oxygen to deoxygenated muscles, I'm telling you, it's not going to hurt you. Now, whether you
Mm.
want to use an estrogen cream to supplement loss of estrogen, that's fine too. I'm a big fan of estrogen supplements. But I also understand that you have these basic skills within your body that if you're not using them, you're cheating yourself.
Mm. Yeah.
And the first time you take down your guarding reflex and you feel the relief of blood flow rush into your pelvic floor, you'll know what I mean.
So, just to be a little, again, just to wrap on the Kegels thing, because people talk about it in so many ways. People have been told to do Kegels to have better, sex, like tightening that area, all of
Mhm.
that. What do you say to those people that are hearing that?
Look, I think if you find that that's helpful for you during sex, do a Kegel. I don't
Mm.
actually have a problem with tightening muscles, but I want you to have the pelvic floor awareness to also know how to release. Because
Mm.
releasing in most cases is the problem, not tightening. I mean, if your partner likes to feel that
Mm.
tightening sensation, go ahead and do that. But
That's
that's a
okay.
short-lived thing of sex. And by the
Mm.
way, what you should know is that if you are tightening really hard, you're probably not going to be able to have an orgasm. So if your own sexual pleasure is part of it for you and not just your partner's, you need to let
Mm.
go because
Mm.
that's how you have an orgasm. You can't just be tightening, 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 reach the or I have a lot of patients who can't reach orgasm because they are tightening their pelvic floors so much
Interesting. Yeah.
and they can't have an orgasm. So what's the point?
Mm. Yeah. Again, back to just, that blood
And
flow.
it causes
Yeah.
pain.
Yeah.
And it causes pain. If you cannot learn to release your pelvic floor muscles during sex, you are going to experience pain, especially after menopause.
Mm.
Or if you have severe pelvic floor dysfunction, you're going to experience pain from that too. Because if you are disconnected and you haven't learned to relax your pelvic floor, you are going to have more pain during sex.
Yeah, yeah. Oh, so much. Okay, so I'm glad. I hope again, the Kegels thing, as you can imagine, it's just like years of being told one way and then, hearing it now from you differently, but it makes complete sense, you
It
know?
does. It
Um,
does.
yeah, so
And a
that's
lot of
that's
my patients tell me that they can't even do Kegels.
right.
And that's because they're already in a Kegel. See, that's what's funny.
Mhm.
We are walking around. We don't understand that our frame of reference is off. So when we think that we're weak, we're actually already in a Kegel over tightened state. And
Mm.
then we wonder why we can't go tighter because it's not possible to go any tighter than we already are,
Yeah,
but we're not holding urine. So we're thinking to ourselves, well, I must not be tight enough. I must not be able to strengthen the way I should be able to strengthen. Not understanding that the reason you're leaking is because you're literally cutting off the blood supply to the other side of your body with
yeah.
with tension, with over
Mm.
tensioning those muscles.
Yeah. And I know we don't listen. I just want to have just a few minutes here for you to talk about that. This also does affect men. I mean, this isn't, we're choosing to make this conversation bigger for women because it is, but this really is, a kind of dysfunction that can happen for men, and learning this breath technique, even for men, right, is beneficial.
Yes.
So can you
So
share a
look,
little bit about that?
I'm happy to. I want to say that women, I think, in general, suffer more from pelvic floor dysfunction than men, and that's what the data says. Women are much more likely to develop pelvic floor issues throughout their life, and a lot of that is because we do push children through that area. But the other thing is because women suffer from way more chronic disease. We have way more problems with mental health and anxiety than men do. Um, and that's just a proven fact. So for women, this is something that we're going to see a lot more frequently. However, men also do suffer from pelvic floor dysfunction, and urology clinics are full of men with pelvic floor dysfunction. Sometimes it's erectile dysfunction, sometimes it's constipation. um, Men are also pushing out their pee, whether they're aware of it or not. I have a lot of conversations with men about this, and I'm always trying to say, listen, I don't have the same anatomy, so I can't speak to what men are doing. But I do know that men standing are automatically pushing, because we cannot release our pelvic floor muscles in a standing position. And a lot of young boys and men do stand to pee.
Mm,
We have the same muscles that men do, and we need to release in a sitting position. We can't stand, we can't hover over toilets, or we're going to start damaging our pelvic floors. And it's the
mm.
same for men. Maybe they're just getting prostate growth out of it, but regardless, we all need to learn to release urine and stool in a coordinated way.
Yeah. So you think so for men, are you saying that if they sat down to pee, it would be better for their overall long-term
There are
health?
studies that show that standing to pee creates obstructive voiding in men compared
Mm,
to sitting. Those are
wow.
those are studies that we
Yeah.
have.
Yeah.
But we don't tell men to sit, and it's very much encouraged that they stand.
It's
We
like a
have
very
built
male thing to
urinals and
do.
all sorts,
So
right?
would you say, I mean, would you suggest that we start, teaching our
Look,
young
I don't
boys?
suggest anything. I
Yeah.
suggest we think. I suggest we
Mm,
take the science of what we know and we actually put it into action. We stop
mm,
running studies that show us the things that we're then not following.
yeah.
Okay?
Yeah.
So if
I
you have
love
a
that.
study that shows that men are obstructed, have more obstructed flow in a standing position, to me, that's a health alert. Okay?
Mm,
But we can say, oh, well, that's just a stupid study. Let's ignore it.
yeah.
But
Or we
we're,
can
we're
say,
ignoring a lot of
it
stupid
doesn't.
studies out of there instead of
All
actually
right. I was
listening
going to
to them.
say, or it doesn't take much. Hey guys, sit down next time you pee.
So
Just try to.
it's not
But the thing,
sexy.
yeah, but
Men find it's much more machismo to stand, I think. If you
maybe,
could have
right?
contests to see who goes further in the snow, right?
Yeah, but that's interesting. I mean, and you're right. This is what I've loved about our conversations, and I know I want to be mindful of your time too, but it really is about, like, it comes back to that curiosity, and that's where even for you, I mean, you could just be this doctor who's doing well in your practice and just keep doing the same thing over and over again. But at some point, you just stopped, and the things you're reading, the studies you're seeing, and it's just digging deeper and then
Yes.
testing, and
I'm
you started testing
translating.
it on
I'm
yourself.
translating. I'm
Yeah,
translating what we know into actual embodied awareness, you know?
right.
And you have to know what pushing is. Like you have to say, you have to pay attention. Like this is
Mm,
about you paying
mhm.
attention to what you are doing on the toilet. What
Yeah.
is that motion that I am making? Is it pushing? I want you to
Mhm,
open your brain up to the fact that it could be, that it is,
mhm,
and that
mhm.
that's something that you've been doing since you were two, and that you don't
Yeah,
have to do that because it's going to cause you problems down the road.
yeah.
Whether it's as a child who's leaking when you're 16 and you shouldn't be, or getting urinary tract infections when you go off to college,
Mm,
or whether you're older,
yeah.
you should have a better awareness of what you're doing.
Yeah, yeah. And I mean, it does work. I will say, sometimes you're on a long flight or you're walking somewhere and the bathroom isn't near. And I remember being in situations where I'm just like, oh my God, I got to find some place. And now I've started using just the breathing technique, the sniff, to bring more, blood flow down there, and it calms everything. And
It
you're like,
does.
all right, I can
Right.
go. I'm good. you know?
So this is something that is very hard for women to understand because we think that if we let go for a minute, we're going to pee on the floor.
Mhm.
And when we get that urge to go, our first instinct is to clamp. That's very instinctual for us. So when your bladder says, "Hey, I'm full," we will automatically clamp around it because that clamping behavior silences the bladder. Neurologically, that's what you're doing. You're silencing your bladder. The thing is that your bladder doesn't need to be silenced. It needs to be talked to. And the only way to talk to your bladder is not with words, it's with breath. So when you want to know, is my bladder really full or am I just stressed out? You need to breathe towards your bladder and
Mhm.
ask it what's going on. A lot of times your bladder's not that full. It's just you're clamping so tightly, it's suffocating. And the only way it can tell you is by saying, "Where's the bathroom?" That's how it's talking to you. So
Mm.
the first thing you do is take a breath. Before you clamp, you take a breath. And you will see that that big urge goes away. And this is
Yeah.
something I train my patients to do because a lot of times, if you're in the middle of a shopping center and you don't know where the bathroom is, there's a fear factor that comes in like, where's the bathroom? What if I
Right.
don't make it? Am I going to embarrass myself? Just
Yeah.
get that stuff out of your head. Just give your bladder some air and it will respond. It will hold
Mhm.
it for you. And then you can casually look for a bathroom.
Yeah. So, we're going to be wrapping up here, but I want to ask you, just anyone listening, what is, when I think about what I want to share with friends, or the easiest thing I could share as I'm having these conversations with you and just trying to, again, get more awareness. We're trying to sort of do this grassroots movement in conversation. The easiest thing I could say is, listen, we got to get more blood flow to our lower regions. It's all connected. Our overall health is connected to our pelvic floor. We need to start paying attention to it more in all sorts of ways. And that's where I just start. And then questions and conversations happen. But where would you like to have people start when they could share this content with their children, with their spouses or friends? What should they be saying?
I want them to learn how to engage their diaphragm. This is a really important concept for all humans to learn. The diaphragm is the most important muscle of our body. It's our breathing muscle, it's our urinating muscle, it's our defecating muscle, and it's right under your rib cage. And when you sniff, you will feel it pop out. And that maneuver is essential to your health. And so if you could just start there, feeling your sniff, pop your diaphragm out, that's a mind body connection. And I think a lot of stuff will just sort of emanate from that. It's a
Mm,
process. It takes time for your brain to understand these maneuvers, but a great place to start is just learn how to engage your diaphragm.
yeah. Well, I mean, thank you so much, Dr. Fleischmann,
You're
Nicole.
welcome.
As I mean,
Rosanna.
really, this is we're going to keep having conversations about this. I'll be sharing more, and we'll be doing that. Your book, The Second Mouth, which I have here as well, is out there, and I think it's still. I mean, you kept the price point on this really low because you really want people just to
I did.
have the information. This
And the
wasn't
book
about
is
making money on a
funny.
book.
It's a funny book. It's really not like
It's
I think anybody could read it. I didn't write it to be,
You're
all
a great writer.
sciencey. I
Mm,
wanted people to understand the way the book is designed is to get people to feel these sensations within our bodies
mm,
and also to understand that every woman on the planet has the same problem as you. Because
yeah.
if you understand that you're not alone, that all of us are suffering with the same exact condition, and that we all can turn this around as a group,
Mhm.
that's how it has to be done. This is a massive effort to turn around and re-toilet train ourselves to not push, to open. And
Yeah.
a lot of our health problems are gonna get better. I'm almost convinced of it.
I believe it, and like I said, I've been testing it in different ways,
Good.
and it's amazing, the difference. I even told you today, I recently, that I've been having some lower back pain, and just breathing into it differently, just that alone has really helped.
Yes,
So,
it's an internal biofeedback system that you have to get to know. It's
yeah.
natural. We're all born with
Mhm.
it. We have to just activate it.
That's it. Well, I love it. I mean, we've been talking about this too, that I just think we're at a time and place where people are paying attention to their bodies in a different way and taking the care to get more curious about it. So I think there's no better time to be having these conversations. So thank you so
I
much
agree.
for continuing to work on this and share this message, and we'll be doing more of that together and separately. So thank you for your time, and I'll be dropping more. That TikTok that you did, I'll take that link and drop it in my like
Yeah, you
LinkedIn,
guys get to
Facebook
watch me
places.
acting out what to do on the toilet.
I
So
love it.
I'll do
It's great.
anything to get people to understand this stuff.
Hey,
So
Sophia gave it a thumbs up. She watched it and
I
she's
have
like,
to learn
"Mom,
how
that
to
was really
TikTok. I know. I'll
that."
do anything
She's
now.
like, "That helped me understand it better." I'm like,
Good.
"Yeah, that's good."
Because he's
So
watching someone do it. That's how
yeah.
modeling works. I mean, you watch somebody
Mhm.
else put their finger under their nose and smell. That you can do it too. Yeah.
Yeah, that's it. All right, everybody, get breath down into the lower regions. Thank
Yes.
you so
Your
much.
lower half. It exists. Go find
That's
it.
it. The second mouth. Learn it, know it. All right.
Know it.
Thank you so much.